Dr Marlain Mubarak. I'm a consultant gynecologist. I was trained on Oxford, and in my last 3 years of training, I did spend 12 months with the Oxford Fertility team, who were as well the endometriosis team. I'm going to talk about fertility, why fertility is important. 80% of the couples are able to achieve a pregnancy within 12 months of trying. However, 20% are unable to conceive. 30% of the couples, the reason of delay in getting pregnant is woman-related problems. 30% it's male-related problems. However, in the other 30%, it's a combination of male and female factors. We know now, with the advances of laparoscopic surgery and the advances of the diagnosis without having to do surgery, that 45% of the couples who are unable to achieve pregnancy, endometriosis is one of the factors. To achieve pregnancy, we need to have an egg, a sperm, and open tubes. It's not as simple as that. There is other factors. In endometriosis, the tubes can be open, there's no problems with the sperms, and the woman is ovulating on a regular basis. However, the endometriosis affects fertility in different ways. One, it affects the ovarian reserve. Women are born with a fixed number of eggs, which we utilize along our life. Endometriosis destroys these follicles and affects the ovarian reserve. The other way it affects fertility, endometriosis affects the quality of the egg, affects the quality of the embryo, affects the implantation, as well. Even in minimal and mild endometriosis, it affects the quality of the sperms because it releases chemicals that can kill the sperms. Medical treatment for endometriosis is of no value. Surgical treatment improves the chances of pregnancy. To check your fertility, we can offer you tests to assess the ovarian reserve. That includes a blood test called AMH, or anti-Mullerian hormones. It tells us a lot of information about the ovarian reserve, including a blood test called follicular stimulating hormone and luteinizing hormone. When a couple come to me who are trying to get pregnant, the first thing is to establish the reason for the delay by doing tests to check the ovarian reserve, check the tubes, as well check the sperm, taking a full history, see if there is any element of endometriosis. Once we establish the diagnosis, then we can decide what is the best treatment for them. In my experience as a gynecologist, I've seen so many couples who struggled to have a baby and even had several attempts of IVF. However, once we managed to establish an accurate diagnosis and treat it, many of them managed successfully to have a baby and have a happy end to the story.